So for today, we have a total of 110 new cases who've been diagnosed with COVID-19, including one epidemiologically linked cases, bringing our total to 10,066 people in British Columbia who've been diagnosed with COVID-19. That includes 3,693 people in Vancouver Coastal Health, 5,174 people in Fraser Health, 223 people in Vancouver Island Health Authority, 557 people in the Interior Health Region, 330 people in Northern Health, and 89 people who generally reside outside of Canada. We have 1,394 active cases in the province right now, 76 of whom are in hospital, 17 in critical care or ICU. In the hospitalized patients, 35 are in the Vancouver Coastal Region, 37 in Fraser, 1 in Interior, and 1 in Northern Health. We have 1 new death today in the Vancouver Coastal Health Region, bringing the total number of people who've died from COVID-19 in British Columbia to 245. And our condolences go to this person's family and to their community, and we all express our condolences for this death. We have 3,139 people under active public health monitoring and 8,398 people who have now recovered from COVID-19. There are no new healthcare outbreaks today, and the outbreak that was declared at the Milieu Children and Family Services Society has now been declared over. So that leaves us with 17 active outbreaks in the healthcare system, 14 in long-term care or assisted living, and 3 in acute care. We're now up to 900 cases in our healthcare system, 528 residents and 372 staff. We have no new community outbreaks, and the one that we had several weeks ago at Tech Coal area in the Interior Health has now been declared over. We do, however, continue to have some community exposures and school exposures, and the notifications of those are on both the BC CDC and the Health Authority websites. So since the start of the pandemic here in British Columbia, there's been a lot of focus on our numbers and our daily numbers. How are we doing? How do we compare? What does it mean? And today we've reached a threshold which is one that makes us pause. We have 10,000 people who have been diagnosed with COVID-19 in the province. And we know that that's an underrepresentation of the impact of this virus, and that there have been more people, particularly early on when our access to testing was limited, who have been infected with this virus. And while we are fortunate that our province and our country has fared better than others, this number does give us reason for pause. It's a reminder that many people have been impacted by this virus. We know that 245 families have been impacted at a time when it's very challenging to come together and to mourn and to celebrate people's lives. It is a reminder that we know what we need to do, and we need to continue to do it. To slow down, to think about what we're doing, to make those smart choices every day. Catching it early, isolating people so it doesn't spread, keeping our numbers small, flattening our curve, which we have been doing. But as we have seen before, that can change very quickly. So please, no matter what the numbers may be, thank you for all you are doing, everyone in British Columbia, and we need to continue to support each other to keep doing our part. I have received some questions, many questions, but many recently about businesses and what we should be doing or what they should be doing if somebody on their team tests positive for COVID-19 or is homesick and is waiting for testing. So much of what is required is determined by how long they were in that workplace, how close they were to others, the types of activities that you were doing, where it occurred. So it isn't a clear answer, unfortunately, but it is important for all businesses to know that you're not alone and you don't have to figure things out on your own. Public health teams will be and are there to assess the risks, to provide guidance, and to help you with what you need to do should somebody on your team test positive. But there are some things that businesses can do and should be doing every day for the health of your employees and also for your business. One of the best things you can do to protect your business is to make it easy for people to stay away if they are feeling ill. Whether that, for some people, it's possible they could work from home. For others, it may mean taking time off. That means in most cases your business can continue without interruption. To do this, though, everybody needs to be aware of and know the symptoms of COVID-19, and as we're heading into respiratory season, this is an important time to remind people so they can arrange to get tested if symptoms develop. And there are lots of resources we have that can support businesses of all types on the BC CDC website and on WorkSafe BC. And we've put together guidance to help you, and there's numbers there that you can call to get advice about how to do this. You should also have symptom screening as part of everybody's workday. This should happen before we come to work, but also a check when people arrive is also a good idea. Another thing you can do is pay close attention and track who is on site on particular days, where they are working, who they are spending time with. And that may be leaders in different areas, keeping track of who's with who, keeping meetings mostly virtual if you can, making sure that when you are, the staff are together, that you're maintaining safe distances, maintaining smaller groups of people that see each other on a regular basis, making sure you have those barriers in place for when people need to come together, and you have minimum numbers of people depending on the size of the room. This goes a long way to supporting rapid contact tracing as well, should it be required. Just as we have our personal layers of protection, I encourage all businesses to regularly look at what you're doing to ensure you are doing all you can to keep COVID away and to know what to do should somebody test positive in your team. So now's a good time to review your COVID safety plan and to talk to the experts at WorkSafe BC if you need some help. I know many people as well are looking forward to the upcoming long weekend, and we've talked about this before. But let's make this Thanksgiving weekend one of gratitude, one of kindness, and we do that by staying local, connecting with each other in a way that doesn't put those we care about at risk. The impact of COVID-19 has been significant across the province, yet there is very great things that we can be grateful for. We can give thanks and continue to find new and safe ways to support each other and show we care. Support your family by keeping your celebration dinner small. Support your friends and neighbors by always giving them the space to stay safe. Support our public health teams by paying attention to how you are feeling and always stay home if you're feeling ill. And if you're out and about and you can't keep your safe distances, it's important to wear a non-medical mask. What we do today and every day makes a difference, and we've seen that. We've seen that in the progression of our pandemic here in BC. We need to all continue to do our part, and we also need to remember that this continues to be our time to be kind and to be calm and to be safe.